Hi y'all, this is our discussion on Cambodia.
As of 2019, communicable diseases in Cambodia have a 26% mortality rate, with morbidity falling in lower respiratory infections being the second leading cause of death, tuberculosis being the fifth leading cause of death, and HIV being the 19th leading cause of death. As you can see by the first chart on the right, the CDC actually has HIV under control in Cambodia. Although it has not been completely eliminated, there are several programs including outreach for sex workers and surveillance programs to decrease the spread of HIV. As for epidemics, dengue fever has had two large epidemics in Cambodia, one being in 2007 and the other in 2012. Dengue fever is primarily an issue during the rainy season, but there is a vaccine for it. Malaria is also an epidemic in Cambodia, but once again, we do have a vaccine for that, and the CDC expects it to be under control in Cambodia by 2030. If you can tell by the chart on the right underneath the HIV chart, the cases of malaria in Cambodia have been dropping. Japanese encephalitis is an endemic in Cambodia because it is primarily persistent in the rural areas. Once again, there is a vaccine for it, and 75% of cases are in children younger than 15 years old, but there is a 30% fatality rate with Japanese encephalitis.
So going into the prevention efforts for communicable diseases, Cambodia was actually one of the first countries to achieve epidemic control for HIV, and they're trying to sustain control and eliminate HIV by working with the CDC and finding undiagnosed HIV cases and retaining their patients on treatment and re-engaging their patients on follow-up to the doctors and strengthening HIV surveillance. Cambodia has actually been controlling or trying to eliminate malaria. They've been receiving assistance from the CDC again, and they've been trying to provide technical assistance for surveillance, for anti-malarial drug resistance. They've been doing vector monitoring and case management and social and behavior change communication. Cambodia was actually known as polio-free in 2000, and there's been a low coverage of the polio vaccine there, which has resulted in the country being at risk for polio. So getting more amounts of polio vaccine is important to return the numbers back to normal there. Lastly, the CDC has been helping to strengthen the quality of laboratory systems in Cambodia to accurately diagnose and monitor the infections from HIV, tuberculosis, influenza viruses, and other pathogens.
Since January 1st, 2020, Cambodia has seen 292 COVID-19 cases and 0 deaths. This is approximately 0.002% of their population. To put this in perspective, almost 3% of the United States population has been infected by COVID at the current time. There's actually a period from April 11th to May 21st where Cambodia saw no new cases. So what was their approach? They closed all schools on March 16th and switched to distance education. They temporarily banned all travelers from certain countries and began to require a negative COVID test for entry into the country on June 11th. A one-week travel ban was imposed within the country in April. Large gatherings were banned until September, and the Khmer New Year celebration was canceled. As of right now, almost all schools are open. They began to reopen in August. The majority of businesses are open with limited exceptions. All out-of-country visitors are welcome but still require a negative COVID test to enter. All travelers must make a minimum deposit of $2,000 when they enter the country to cover the cost of their COVID testing and quarantine until the results come back. Further fees are incurred for accommodations and healthcare if you test positive. This is an interesting way to deter visitors while at the same time ensuring that everyone who does want to enter the country won't bring COVID in.
Cambodia, categorized among the low and middle-income developing countries, faces both communicable and non-communicable diseases as major public health threats. In terms of funding, infectious diseases do tend to garner more attention, generally speaking, but as evidenced by the graphic on the slide, there has been a shift in recent years to focus more on the burden of chronic and lifestyle illnesses. These non-communicable diseases, abbreviated as NCDs, include heart disease, diabetes, cancers, hypertension, etc. The percentage of the population suffering from such conditions in Cambodia has risen steadily over the last decade or so, according to data compiled by the WHO. 15% of the population is overweight, 16% have hypertension, 1 in 5 have elevated cholesterol, and tobacco use is estimated to be at about 37%. Furthermore, mortality from NCDs has risen from 33% to 61% over a 15-year period, from 2000 to 2015. When it comes to revitalizing and improving global health infrastructure, especially on the regional level in a developing nation like Cambodia, it is of utmost importance to take these factors into consideration.
The main 4 non-communicable diseases that Cambodia struggles with are cardiovascular disease, cancer, chronic respiratory disease, and diabetes. These 4 account for nearly 50% of all of the deaths in Cambodia. Additionally, these deaths are projected to rise due to the changing lifestyle and the environments that the Cambodian people live in. These 4 diseases can be prevented through addressing these 4 challenges: tobacco use, alcohol use, unhealthy diet, and the lack of physical activity.
For nutrition in Cambodia, the prevalence of under 5 stunting and low birth weight has decreased to some extent from 2019, but adult male obesity, WRA anemia, under 5 wasting, exclusive breastfeeding, adult female diabetes, under 5 overweight, adult female obesity, and adult male diabetes are all reported to have no progress or worsening for the year 2019. Nutrition and Global Health examines diet, which can decrease the risk of developing chronic diseases, in addition to the other things listed above. The diets are usually low in fat and sugars, rich in fruits, vegetables, and whole grain products. And now looking at fat, sugar, fruit, and vegetable and whole grain intake in Cambodia, it's evident that Cambodia is struggling to stay around the TMRELs for these categories, whether something is much lower or higher intake than it should be. TMRELs are the theoretical minimum risk of exposure level for men and women aged 25 and older. The 2 graphs on either side are a couple of the determinants of nutritional health for Cambodia. The graph on the left is the percent population experiencing undernourishment, which has been decreasing slowly since 2001. The graph on the right is food supply determinants. The availability of fruits and vegetables is pretty much hovered around the same mark, which is not helping the low intake levels of fruits and vegetables in the general population side. The blue part of the graph is the percent of total calories from non-staples, which is about a third of any given person's diet and is pretty significant. So overall, it seems as though more is going to have to be done to improve nutritional health in Cambodia, most likely with outside help.
Cambodia is a lower middle income country, and when it comes to pollution, they experience an above average percentage of deaths when compared to other countries of the same economic standing. In 2015 alone, Cambodia had 15,500 deaths from pollution-related diseases, as shown by the graph. When comparing this to other causes of death in Cambodia, this is more than those caused by HIV, tuberculosis, and malaria combined. This is also narrowly higher than the amount of deaths caused by tobacco use. Concerning sanitation, there is a great disparity between rural and urban areas. Only 16% of rural areas in Cambodia have access to improved sanitation compared to 55% of urban areas. 76% of urban areas have access to clean, safe water compared to 42% of rural areas. This is troubling when 80% of the population lived in rural areas in 2010. Data from 2007 shows that water sanitation and hygiene has a much higher amount of dailies associated with it when compared to air pollution. This may come as a result of diarrhea being one of the most common causes of mortality in children under the age of 5. Improper sanitation and subpar water quality are one cause of diarrhea. Cambodia has a tropical climate and normally experiences distinct rainy and dry seasons during the year. The rainy season lasts from May to October, and a majority of Cambodia's annual precipitation takes place during this time. It is commonly accompanied with monsoons and flooding. Analysis of data from 1960 to 2003 found clear evidence of the changing climate in Cambodia. Each decade saw a 0.18 degrees Celsius increase in average temperature, in addition to an increase in frequency of hot days and nights by almost 50 days across the entire time period. This may seem minimal, but Cambodia is one of the most vulnerable Southeast Asian countries to climate change due to a couple different factors. The country is still recovering from political instability due to a civil war leading up to the turn of the century. Cambodia, as a mainly rural, lower middle income country, is also lacking in physical infrastructure. The large disparity between urban and rural areas in sanitation and water quality reflects this. A third of the country's GDP is based in its agricultural industry, which is very sensitive to changes in the climate and weather. Cambodia's 13th SDG focuses on reducing the effects of climate change. However, no data has been given since implementation as to what progress may or may not have been made on this issue. Cambodia is also already vulnerable to environmental disasters. Flooding as a result of monsoons and storms is very common during the rainy season, and the Tonle Sap and Mekong rivers and their tributaries are known to experience major fluctuation in water level with the increased precipitation. The majority of the country's population lives along these rivers. The severity of the flooding can vary, but has drastic effects when extensive. Cambodia saw 70% of its rice crop destroyed between 1998 and 2002 by flooding, and 438 lives were claimed just between 2000 and 2002. Major flooding in 2011 and 2013 saw approximately 750,000 households affected by flooding, 418 deaths, hundreds of thousands of acres of crops destroyed, and roads and infrastructure damaged nationwide. The map on the bottom right demonstrates the flood mortality risk, and you can see that it is very high throughout most of the country. It is even estimated that around 100 deaths a year can be attributed to flooding in Cambodia. The floods mentioned above are estimated to have caused more than $1 billion in damage, with more than $100 million worth of agricultural losses occurring each year. Typhoons only compound the detriments of the rainy season floods and monsoons. An average of 27 affect East Asia annually, and a portion of those are not weakened by traveling over land before they reach Cambodia. Droughts in the dry season that result from a late start or early into the rainy season have also had a detrimental effect on the country as well. The 1998 to 2002 time period saw 20% of the rice crop destroyed as a result of drought. Economic losses such as these can induce poverty and malnutrition within the population. The lack of infrastructure is also amplified during these times, as the loss of crops is greater due to a lack of agricultural irrigation. The effects of climate change Cambodia is already facing are expected to only increase in the coming years. By 2100, it is expected that the country's GDP will have decreased by 6 to 7% as a result of climate change. Environmental disasters like the ones discussed are expected to become even more common as temperatures rise. Rainy seasons will be shorter and more intense, while dry seasons will be hotter and drier. These are our citations. Thank you for watching.